I've been working in rural health for over 30 years now, and these last 3 years, especially with the COVID pandemic, was really the culmination of much of what I've done in life. So for many years I was in the Navy, and the Navy was about getting things done right away. And then I've worked here in town as a pediatrician, and also worked a lot with the government and governmental health, especially Medicaid. And now over the last 5 years I've been the public health officer.
I was aware right off the bat that Dr. Bob was not only going to be pivotal in how people knew about COVID, he was maybe the only person in our community who was going to be able to distribute and provide that information accurately and well.
Dr. Dannenhoffer wears many hats, so one of them being the public health officer for Douglas County. When the COVID pandemic started, he was really in full swing.
It was amazing how much information Dr. Bob had. In those early days, yeah, it was like he'd been through this before and none of us had.
So this big pandemic did not come as any surprise to anybody who's been paying attention to what's happening in public health. Douglas County is the perfect size for getting things done. We have enough people on staff to get things going, but not so big that it takes a long time. So we were the first county to have drive-through COVID testing. We were the first county to have the COVID hotline, and we were one of the very first to do the drive-through vaccine clinics.
Dr. Bob was the absolute perfect person in a perfect spot for us here for what he ended up doing.
He is an amazing educator. He is available anytime we need him to ask questions, to run cases by, consult, and he's just really a great team member to work with. He makes work fun. He's just been a really great experience to work with him.
Dr. Bob is a hero, and I'm not just throwing that word around. He was a sense of calm and consistency and accuracy and kindness at a time when all of those things were very hard to find.
Well, I think it's all a big mistake because I'm no hero. It's a great honor, but I think it really shows how rural health is so incredibly rewarding.